Okay, this is the maternal child final exam review. Ear exams. How do you move the ear when looking at the canal? For a baby, down and back. Preschool child, up and back. School entry or preschool health screenings should include vision screen, hearing screen, review of immunization records. Potential impacts of hospitalization, developmental regression, interference with developmental tasks. Safe medication administration for children. Be direct with them. Birth weight is doubled at 6 months and tripled at 12 months. Beginning with preschool age, children may have myringotomy tubes, which are small circular plastic tubes placed into the tympanic membrane to relieve chronic fluid collected in the middle ear. What is the appropriate technique for administering eardrops based upon age? Under 3, down and back. Over 3, up and back. Tonsillectomy care. After 24 to 48 hours, children are gradually advanced to a diet of soft foods such as gelatin, mashed potatoes, soups, and cooked fruits. Croup is inflammation of the larynx, trachea, and major bronchi. The age range is 6 months to 3 years. It's a viral caused by para-influenza virus. The symptoms are a barky cough, inspiratory stridor, and marked retractions. The diagnosis is soft tissue imaging of neck shows steeple sign. The management is maintain airway, rest, elevate the head of bed, humidified air, and dexamethasone. Bronchiolitis, caused by RSV or other viral pathogens. It's the inflammation and edema may lead to bronchospasm. The presentation is significant upper airway congestion and wheezes. Management is aimed at the management of symptoms, elevate the head of bed, provide cool humidified air, offer clear liquids by mouth, and possibly intravenous fluids. Asthma, the symptoms is recurrent wheezing, shortness of breath, exercise intolerance, associated allergies, cough at night, and prolonged expiration. Medications would be quick relief like a SABA, which is albuterol, or a LABA, which is long-term inhaled corticosteroids, or for acute exacerbations by mouth corticosteroids, which is dexamethasone or prednisone. And education is an asthma action plan, peak flows, prevention inhaler use instructions, use for asthma, bronchitis, etc. Respiratory distress syndrome is a severe breathing disorder. It can develop if there is a lack of surfactant or it has not changed to its mature form at birth. Pneumonia causes is viral, bacterial, and it's atypical. The assessment is productive harsh coughs, respiratory distress, crackles, fever, and diminished breath sounds. The diagnosis is clinical chest X-ray. Management is supportive care, oxygen as needed, fluids, antibiotics if bacterial, bronchodilators if indicated by presentation, usually able to be managed at home if O2 stat is not compromised. Teaching is small frequent feeds, give meds as ordered, offer clear liquids, and avoid dairy. Recovery takes longer, it's about 2 to 3 weeks. Lung sounds and pneumonia care. Gastroenteritis, symptoms is vomiting and diarrhea. Management is symptom control and replacement of electrolytes. Assess for dehydration. Pyloric stenosis. The exam is for an olive-shaped mass palpated from the left side and located above and to the right of the umbilicus in the mid-epigastrum beneath the liver edge. The diagnosis is by ultrasound. X-ray shows dilated stomach and loaded absent gas pattern in the lower GI tract. Symptoms is weight loss, dehydration, constipation, olive-shaped mass, vomiting after feeds, projectile vomiting. Treatment is pyloromyotomy, sometimes conservative with spontaneous correction. Salt-losing congenital adrenal hyperplasia. This is complete blockage of cortisol formation. Aldosterone production will also be deficient. Salt is not retained by the body, so fluid is not retained, which turns into dehydration. Cushing's syndrome is overproduction of the adrenal hormone cortisol. Integumentary. Why is debridement important and what complications does it prevent? It's the removal of necrotic tissue on which microorganisms could thrive from a burned area to reduce the possibility of infection. Priority concerns for patients with the burn injury: protect the airway, fluid replacement, risk for infection, pain management, debridement to reduce infection. Anaphylaxis. You give epi first, followed by oxygen, IV fluids and meds. Always go to ER even if the symptoms subside. Cardiac. Ventricular septal deficit. VSD occurs when a portion of the ventricular septum does not completely close. Congenital adrenal hyperplasia causes the adrenal glands to be unable to synthesize cortisol. Male fetus has overgrown genitalia, and females are masculine features, like an overgrown clitoris. Echocardiogram is looking at blood flow through the heart. PDA is patent ductus arteriosus. The PDA murmur is distinctive in sound and location, best heard at the left subclavicular margin, described as machine-like, to and from, or continuous murmur. Cardiac cath care. NPO is 4 to 6 hours prior to the procedure. Maintain hydration. Assess for allergies prior to surgery. Because of the contrast dyes, lay flat and keep the affected extremity level following the procedure. Maintain pressure on the site of insertion following the procedure. Apply direct pressure above the cath site with bleeding. Tetralogy of Fallot. This is a cyanotic defect caused by pulmonary artery stenosis. VSD is overriding aorta and right ventricular hypertrophy. Systolic murmur is noted at the left upper sternal border. The management is soothe the child if he or she is upset and bring the child's knees tightly to the chest to increase systemic vascular resistance. Coarctation of the aorta. This is a deficit typically located at the level of the ductus arteriosus insertion. Must assess the patient for the presence of pulse equally. Pulses should be felt simultaneously in all areas. Rheumatic fever. This is an autoimmune response that follows a group A beta hemolytic streptococcal infection. Kawasaki disease labs, CBC, ESR, echocardiogram, and occasionally a cardiac cath. Neurologic. So the primitive reflexes. Moro is startle reflex. It goes away at 4 months. Babinski is a newborn fans their toes. Palmar grasp is grasp an object placed in their palm by quickly closing their fingers on it. Lung sounds common with bacterial pneumonia is crackles and coarseness. Tasks completed during preschool health screen is hearing, vision, and immunization. Parents develop trust with infant by responding during Erickson's infancy stage. Treatment of pain for dysmenorrhea is NSAIDs, ibuprofen first, then naproxen. Important teaching for prescribed antibiotics, finish all the meds. Report abuse during any abuse case. Rheumatic fever is a complication of strep pharyngitis. Post-tonsillectomy care is prevent dehydration through popsicles and ice chips. Signs of pneumonia is productive cough, fever, and crackles. Nursing considerations for pancreolipase is take before snack or meal. Metered dose inhaler, shake before use, exhale deeply, activate inhaler and place in mouth, begin to inhale, long slow inhalation, hold breath for 5 to 10 seconds. Common treatments of croup: racemic epi, corticosteroids, humidified air, and cool air. Digoxin improves myocardial contractility. Withhold for infants if pulse is less than 90 and 70 for children. Chest tube nurse care is clamp the tube if it becomes disconnected. Patent ductus arteriosus sounds like a murmur in the left. Teaching consideration for tetralogy of Fallot is knees to chest. Signs and symptoms of placental abruption is contractions every minute, firm or rigid abdomen, and dark vaginal bleeding. Signs and symptoms of placental previa is bright red bleeding. Sickle cell anemia nursing interventions, hydration, pain management, it's autosomal recessive. Signs and symptoms for severe dehydration, sunken eyes, sunken fontanelles, increased heart rate, give fluids. Infant car seat, back seat, rear facing until 2 years old, 5-point harness. Common cause of glomerular nephritis is group A beta hemolytic streptococci. Give growth hormone to treat growth hormone deficiency. It may result from non-malignant cystic tumor that puts pressure on pituitary gland. Signs and symptoms of type 1 diabetes is increased urination, thirst, weight loss. Main cause of type 2 diabetes is lifestyle, diet, and obesity. Signs and symptoms of newborn hypoglycemia, jittery, respiratory distress, cyanosis, apnea, high-pitched crying, lethargy, and seizures. Acute lymphoblastic leukemia, avoid rectal temperature, bleeding, it can cause bleeding or bruising. Teaching points on child receiving iron, take with orange juice, it can cause constipation and dark stools. Cushing syndrome, moon face, purple striae, which is stretch marks, and ballooning out. Failure to thrive infant is an infant under the 5th percentile. Signs of sexual abuse, abdominal pain, not doing well in school, trouble sleeping, acts weird around the person, and isolation. Cast care, check pulse and cap refill. How to prevent child obesity, balanced diet, sports, activities outside of school. Epiphyseal lines, ossified growth plate, closes at 16 to 17 for female and 18 to 20 for males. Anterior fontanelle closes at 12 to 18 months. Posterior closes at 2 months. Main concern for mom with an LGA baby, postpartum hemorrhage. Signs and symptoms of respiratory distress in the newborn is tachypnea, retractions, sternal retractions, and nasal flaring. Drug screen collected on pregnant individuals is urinalysis, tobacco, alcohol, and substances. Heart sounds are found high in abdomen during breech presentation. Discontinue Pitocin when contractions are greater than 90 seconds and are back-to-back. Signs and symptoms of increased intracranial pressure, increased head circumference, bulging fontanelles, decreased pupillary response, elevated temp and BP, and vomiting. Increased intracranial pressure vital signs, bradycardia, and decreased respiratory rate. Signs and symptoms of spastic cerebral palsy, strong moral reflex, stiff, tight muscle, limited mobility, crossed knees, walking on tiptoes, positive Babinski. Tonic-clonic seizure, bites tongue, pees on self. Absence is stares off into space. Nursing care for myringectomy tubes, do not let water into ears, does not cause hearing loss, and can be taken out in 6 to 12 months. Patient education of cast care, keep elevated for 24 hours, observe for blueness, put nothing in the cask, and keep it dry. Leg, calve, Perthes disease treatment. Do not use affected extremity to bear weight, non-weight bearing brace, good skin care to prevent skin breakdown, pain management, and bed rest. Signs and symptoms of post-op infection, redness, swelling, odor, infection present, and purulent drainage. Treatment of burn and emergency wound care, pain and prevent infection. Sickle cell anemia, hydrate. Atopic dermatitis teaching. Do not apply alcohol or peroxide. MMR is given at 12 to 15 months, 4 to 6 years, and 11 to 12 years. It prevents measles, mumps, and rubella. Signs and symptoms of varicella is maculopapular rash or vesicles, low-grade fever, and malaise. Signs and symptoms of pertussis, high-pitched crowing sound, cough, and low-grade fever. Types of burns. First degree is a sunburn. It's superficial. Second degree is extreme pain, blisters, superficial partial thickness. Third degree is deep partial thickness. Fourth degree is full thickness. Third and fourth degree are critical. Patient teaching for GERD. Prevent reflux, avoid laying down after a meal, avoid acidic foods, avoid fatty foods, and eat small meals. Exotropia is one eye deviates to the middle. Hyperopia, this is the ability to see far away and but blurry close up. And strabismus is cross-eyed. Nursing tasks during blood transfusion. Stay with patient 15 minutes. Monitor vitals and lung sounds. Signs and symptoms of Kawasaki disease. Edema of hands and feet, conjunctivitis without drainage, and strawberry tongue. Glucose intolerance test is done at 24 to 28 weeks, and Group B strep is done at 36 weeks. How to perform and document a non-stress test. Record any accelerations, decels, and variability of fetal heart rate. Fetal heart rate, the normal range is 110 to 160. It's located according to gestational age. Priority nursing intervention of a prolapsed cord is place pressure upward against presenting part. Contraindications to circumcision is bleeding and epispadias. Epispadias is dorsal. Signs and symptoms of pyelonephritis: nausea, vomiting, malaise, pain, frequent urination, and fever. Patient with epiglottis, place in the upright position. Echocardiogram will assess a new heart murmur. GTPAL. G is total births, T is term, P is premature, A is for abortions or miscarriages, and L is live birth. Nagel's rule, go back 3 months, add 7 days. Vertex is head down, breech is feet first, transverse is transverse in the uterus. Oxytocics contract the uterus. This is Pitocin, Methergine, Hemabate, and Cytotec. Tocolytics relax the uterus. This is magnesium sulfate, terbutaline, and nifedipine. Newborn vital signs. Heart rate is 120 to 160, beats per minute. Respirations is 30 to 60, and temp is 36.5 to 37.4. Erickson stages. Infant is trust versus mistrust. Toddler is autonomy versus shame and doubt. Preschool is initiative versus guilt. School age is industry versus inferiority. Adolescence is identity versus role confusion. Osteomyelitis management is IV therapy. Kubler-Ross stages of grief is denial, anger, bargaining, depression, and acceptance.
Bronchiolitis is caused by RSV, inflammation, and edema may lead to bronchospasm. Presentation is significant upper airway congestion and wheezes. It's not reversed with albuterol. Management: elevate head of bed, provide humidified air, clear liquids and IV fluids. Teaching: steamy shower or cool mist humidifier in the room. The first 72 hours is critical. Peaks about day 5 and cough will persist for 2 to 4 weeks. Asthma: wheezing, prolonged expiration, retractions, tachypnea, decreased O2 saturation. Medications is SABA, this is a rescue med, bronchodilator, albuterol. LABA is long-acting. Inhaled corticosteroids is fluticasone, beclomethasone, and budesonide. Systemic corticosteroids is prednisolone, dexamethasone, and prednisone. How to administer nebulizer treatment: hook up the tubing to the air source, grab your appropriate delivery system such as a mask, take vitals before, Instruct the patient that treatments will last 10 to 15 minutes. Take slow, deep breaths. Advise to rinse mouth after a corticosteroid. Croup. Age range is 3 months to 5 years. It's most common at age 2. Symptoms is URI symptoms, barky cough, stridor, and dyspnea. Management. Elevate head of bed, provide humidified air, corticosteroids, racemic epi for stridor at rest. Only clamp a child chest drainage tube if the tube becomes disconnected. That's a one-off. Pneumonia. Causes viral, bacterial, and atypical. Assessment. Cough, respiratory distress, crackles, fever, diminished breath sounds. Management. O2, antibiotics, fluids, and bronchodilator. Teaching. Small frequent feeds, give meds as ordered, offer clear liquids, avoid dairy, and recovery takes longer, about 2 to 3 weeks. Cystic fibrosis. Dietary considerations. High protein, high calorie, pancreatic enzymes before meals and snacks. Epiglottitis, nursing care. Prepare from intubation, provide humidified O2, monitor continuous oximetry, administer corticosteroids and IV fluids, administer antibiotics via IV, then transition to oral 10-day course, droplet isolation precautions the first 24 hours after IV antibiotics. Tonsillectomy care, ice collar, ice chips, pain meds on regular schedule. Instructions: discourage coughing, throat clearing, and nose blowing. Avoid straws. Diet: avoid red colored fluids, citrus juice, and milk-based foods. Patent ductus arteriosus, or PDA. Murmur best heard in the left subclavicular margin. Cardiac cath care. NPO is 4 to 6 hours. Maintain hydration. Assess for allergies. Lay flat. Maintain pressure on site. Tetralogy of Fallot. 4 components: pulmonary artery stenosis, VSD, overriding aorta, and right ventricular hypertrophy. Assessment: systolic murmur noted at left upper sternal border due to turbulent flow out of the right ventricular outflow tract. Lord. During a spell, the child becomes distressed and irritable. Place them in knee to chest position. Coercion of the aorta. Must assess pulse equally in upper and lower extremities. While the child is supine, palpate the right radial and femoral pulse concurrently. Pulses in both areas should be felt simultaneously without delay. Rheumatic fever. Autoimmune disease that occurs as a reaction to group A, strep, specifically pharyngitis. Inflammation from the immune response leads to inflammatory lesions found in the heart, blood vessels, brain, and joints. Kawasaki disease. Persistent fever, skin rash, cervical lymphadenopathy, edema and erythema of hands and feet with peeling skin, irritation and inflammation of the mouth, strawberry tongue, conjunctivitis. Diagnosis: there's no specific test to diagnose, and the labs are CBC, ESR, echocardiogram, occasional cardiac cath. UTI. Possible symptoms in infants is irritability, fever, and vomiting. In older children, abdominal pain, malaise, fever, and enuresis. Teaching: take all antibiotics as directed for full duration of therapy. GU assessment of newborn. Epispadias is upper side of penile shaft. Hypospadias is lower underside of the penile shaft. Vesicorectal reflex. Frequent urinary tract infections. Why couldn't they just say that instead of this big-ass word? Glomerulonephritis. Inflammation of the glomeruli of the kidney. What causes it? Group A, beta hemolytic strep. Wake up, Kim. Anemia. Fruit juices enhances iron absorption. Milk blocks it. Normal hemoglobin values. Newborn is 12 to 18. 2 months is 9 to 14. 2 years is 10 to 12, 6 to 12 years is 11 to 14, and 12 to 18 is 10 to 15. Side effects with iron supplements: decreased appetite, black stools, and constipation. Sickle cell, autosomal recessive, priorities is oxygenation, hydration, and pain management. Blood product administration. The maximum time for the infusion is 4 hours. Save the transfusion bag for at least 1 hour after the transfusion has ended. Potential causes of seizures: febrile, electrolyte imbalance, space-occupying lesions, increased intracranial pressure, and hypoglycemia. Absent seizures: no loss of consciousness, red flag is spacing out, and new onset of enuresis. Increased intracranial pressure, vomiting, increased fatigue, decreased pupillary response, bradycardia, decreased respiratory rate. Meningitis, headache, nuchal rigidity, and fever. Atopic dermatitis, use fragrance-free dyes and moisturizers. Topical steroids, antihistamines, monitor for infection. Methergine is given when there's abnormal bleeding or hemorrhage in postpartum period. Carbapose promotes uterine contraction in the instance of uterine atony and postpartum bleeding. It's safer than methergine in a hypertensive mom. Contraceptive options: hormonal is progestin-only pill, combination oral contraceptive, levonorgestrel-releasing IUD, the NuvaRing, Nexplanon, Depo-Provera, and the transdermal patch. Non-hormonal is natural family planning, copper IUD, and barrier methods. STIs and treatments. So syphilis is penicillin G. Chlamydia is Zithromax. Gonorrhea is ceftriaxone and Zithromax. HSV is acyclovir. Tricon Monas is metrondiazole. BV is metrondiazole. Candidiasis is turconazole vaginal cream and diflucan. The 2020 National Health Goals for Pregnancy: stop smoking and alcohol use, eat a healthy diet, take prenatal vitamins, take folic acid at 400 micrograms, and achieve optimal nutrition status prior to conception. Positive and probable signs of pregnancy. Probable is abdominal enlargement. Heeger sign, the softening of the lower uterus. Chadwick sign, which is the violet bluish color of the cervix and vaginal mucus. Goodell sign is softening of the cervical tip. Braxton Hicks contractions, positive pregnancy test. Positive signs is fetal heart sounds, fetal movements, and visualization of fetus on the ultrasound. Fetal development stage. Embryonic stage is from 2 weeks until 8 weeks of life. During this time, organs are mainly formed. During this rapid cell division and forming of organs, if exposed to viruses or drugs, this can cause harm to the fetus. Fetal development stage is defined from 9th week until birth. Postpartum blues is normal, related to hormonal changes that should resolve on their own. Feelings of inadequacy, anorexia, sleep disturbance, irritability, and mood liability. And postpartum depression is a major depressive episode with the onset of pregnancy within 4 weeks of delivery. Signs and symptoms are present for over 2 weeks, and signs and symptoms is anxiety, sadness, anger, difficulty sleeping, and intrusive thoughts. Postpartum psychosis is a rare mental health emergency. Signs and symptoms are confusion and cognitive impairment, disorganized behavior, and hallucinations or delusions. Magnesium sulfate relaxes smooth muscles, suppressing contractions. Monitor for pulmonary edema and toxicity. The antidote is calcium gluconate. And do not use with nifedipine, and do not give if they're over 34 weeks gestation. Terbutaline is a tocolytic. It relaxes smooth muscle, suppressing contractions. It's to stop preterm labor. Monitor for palpitations, tremors, tachycardia, hyperglycemia, hypokalemia, and hypotension. Contraindications is cardiac disease, diabetes, preeclampsia, hyperthyroidism, and significant hemorrhage.